So what cat? I know, I love that picture. I think I Googled cute cats and that came up. All right. What cats should be tested? So in an ideal world, we would really test all adoptable cats and kittens. But if you guys need to target your testing for financial reasons, we really need to test everybody that lives in group housing, whether that's within the shelter, so in a communal housing situation, whether it's within a foster home or in an adopter's home. And then if you guys have like a sanctuary setting where you're keeping FeLV positive cats, or you're adopting out cats that have seemingly terminal illnesses or upper respiratory infections that won't clear up, or they have chronic weight loss, those are definitely cats that you want to test so you know their status. Okay, here's the big kitten debacle, right? So a lot of people want to know, okay, can we just test one litter or one kitten within a litter? Another question that we commonly get is, can we pool samples from 4 different kittens and use that on one test? And the answer to that is that it's really less than ideal. And the reason for this is because we have this lovely little FeLV positive mom with her 2 adorable kittens. And this kitten can be exposed in utero, so in the uterus. It can be exposed from milk from the mother, and it can also be exposed saliva from grooming after the kittens are born. This kitten immune system will not clear the virus always, so these kittens will become FeLV positive. Adult cats have a lot easier time clearing the virus than kittens do. However, some kittens' immune system will kick in and clear the virus. So you can imagine with this situation, you can have some kittens that are positive and some negative within the same litter. And then for some reason, an FeLV positive mom might not expose any of her kittens for some reason, you know, when they're in utero. So all of these guys will be negative. So a really important take-home message here is that just because you have an FeLV positive mom, it doesn't necessarily mean that the kittens are exposed, okay? And another important point is that just because you test one in a litter and it's negative, that doesn't mean that all the other kittens are. So ideally, we're testing everybody. And I know this can get expensive, but this is just the science, just so you guys understand. Yeah? So the question was, will the kittens be continuously exposed to an FeLV positive mother, you know, from saliva? Yes, they'll be continuously exposed. So ideally, we would remove them from their mother if you have the resources to bottle feed, which I know is really fun, but I know. Yep. The question was, what age can we start testing these kittens? This is a good question. Some of them will be positive right off the bat, but some of them can take a while, and we'll talk about this when we talk about retesting and everything, but it can take up to, 12 weeks for them to seroconvert or become positive.